Hey, I'm Mack. Welcome back to my channel. I just wanted to quickly say thank you to each of you who have decided to subscribe to my channel and to everyone who has actually gone and shared one of my videos or told others to subscribe. I really, really appreciate it. I never really expected this, and frankly, it's still a little bit confusing to me that people want to actually listen to me talk and that I can earn money from it and build a community with it. It's been really exciting. It's been super fun. So I just wanted to say thank you, as I have now hit 5K, 5,000, big milestone. So as always, don't forget to like, subscribe, hit the bell, and consider joining my Patreon. Patrons get access to new videos 12 to 24 hours early without ads, and have access to all my videos in an archive without ads. And without further ado, let's get into the video. Hopefully everybody knows who Rachel Hollis is, and if you don't, she's basically a motivational speaker and self-help book author who has been plagued with scandals pretty much ever since her book, Girl Wash Your Face, became a bestseller. Scandals range from plagiarism to the fact that she held sold-out conventions centered around marriage advice, with tickets costing thousands of dollars, all while her own marriage was in shambles, unbeknownst to her fans, until she and her husband, Dave, announced their divorce. She announced on a recent podcast episode that she had an appointment for a brain scan with a Dr. Amen, who frequently works with people like Rick Warren of The Purpose Driven Life and Saddleback Church, and Dr. Oz, while being held in nearly unanimous condemnation by the medical community for his unscientific approach to medicine, unjustifiable treatment choices, and practice of routinely misinforming patients through promotion of pseudoscientific claims, both in his clinical practice as well as on the late night infomercials through which he sells his line of wellness products. I'm going to preface this video by saying that I do have my doctorate in pharmacy and I am a licensed pharmacist. I'm not practicing, and I have not been for the past couple years. I had to step back from that because of some personal shit. Hashtag checkered past. And at this time, due to the quickly deteriorating working conditions in the pandemic times at retail pharmacies, I currently have little interest in returning. I love my current job. It is very low stress, but it's also very rewarding, and I personally work closely with the owner. And that's all I am going to go into about that. But just in case there was any confusion about my knowledge, background base or whatever, that's the deal. And before we go into the video, I just have to say that before even watching this, I really love that Dr. Amen here is giving people scans of their brain with absolutely no medical indication whatsoever. It's really great that during this medical and public health crisis, he's making sure that we still find the time to waste some resources and give people even more medical treatment that they do not need and that will not help them in any way whatsoever. It's really great. Dr. Amen may be a doctor, but that doesn't mean his clinical decision-making is appropriate or remotely in line with other guidance that is evidence-based in the field. For one, we already do far too many extraordinarily costly imaging procedures in this country, and to zero benefit to our healthcare outcomes. This is one of many, many, many contributing factors to the United States having by far the most expensive healthcare system in the world, but by far the worst healthcare outcomes in the developed world. Like, what is the indication for this brain scan, doctor? If you're wondering if I had as much attitude when I was practicing as I do now, like, there's your answer. Is this new information you are hoping to uncover? That's certainly within your credentials to do as a doctor, but I'm sure you understand that Rachel is your patient. She is not a clinical research subject. If you want to do research, then maybe you should go through an institutional review board. So explain to me what guidance says this brain scan should be happening. Find me a doctor on an accredited neurology board that agrees this is appropriate. Why doesn't anyone agree with you? Why doesn't anyone else find the results you are finding? This video was posted to the Dr. Amen Clinic's YouTube channel, and let's see what happens. The title of this video is "Can You See Trauma in the Brain?" Which I love, because I love when articles or videos have a yes or no question as the title, because most of the time I would just go, okay, can you see trauma in the brain? No. Great. Didn't even have to watch the video or read the article. But we're going to give him a chance, okay? We're going to give him a chance. God, look how happy she used to be. Rach, those are some old pictures.
How are you?
Oh, it's so nice to see you.
Nice to see you. Thank you.
I love that for a doctor not wearing a mask. She's not wearing a mask. Amazing. Love it. You love to see it.
I'm so excited.
Thank you for doing this.
Thank you.
With us.
I'm really excited and hopeful.
But I want to hear.
I'm going to guess, based on the fact that he just said thank you for doing this, that she does not have to pay for this, probably, like his other patients do. That's just my suspicion there.
Hear from you your goal.
So I feel like I've had a really hard time controlling my emotions. I will be honest with you and say I probably would just deal with that, except that it's affecting my ability to be productive and to do my work well and to be the kind of mom that I want to be and the kind of human that I want to be. So I want to figure out what's up.
Okay, so to summarize in the terms, the way that you would for a clinical case, okay, so we got RH is a 38-year-old female complaining of difficulty controlling emotions that is affecting her ability to complete her work tasks and interact with her children in the way that she wants to. To the vast majority of healthcare professionals, and especially psychiatrists, the fact that he could hear these details in this chief complaint and that his recommendation is a fucking SPECT scan is frankly shocking. SPECT, or single photon emission computed tomography scans, are sort of the favorite imaging technique of Dr. Amen. SPECT scans measure the blood flow in different areas of the brain and are performed by injecting the patient with a radioactive isotope tracer and then subjecting them to radiation. It's basically a CT scan, but with the added element of the radioactive injection that enables display of blood flow to various areas of the brain in the final image. Dr. Amen normally charges $3,500 for the procedure and seems to perform the scan for every patient, whether it's for ADHD, addiction, anxiety, depression, obesity, or even marriage counseling, or worse, a general brain health checkup, which is not a thing and certainly not a good reason to be injecting a patient with a radioactive solution and exposing them to radiation they shouldn't get to create an image they do not need.
That's what's going on. I remember for a decade, all I wanted was to be a New York Times bestseller.
Is that when Girl Wash Your Face was
Yeah,
released?
that's when it was.
And then just
beginning
became
of
a
2018.
monster
And it just
success.
went. And I had no idea what I was supposed to do with that.
Fame wears out the pleasure centers in your brain.
Right.
And so we have these two areas, part of the basal ganglia, that respond to dopamine.
Yeah.
When fame hits, it's like a lot of dopamine gets released.
Right.
And it feels awesome. But then it wears them out.
Mm-hmm.
And then you start feeling flat.
Yeah.
Why are you saying right and yeah, Rachel?
And it takes more and more for you to feel
Right.
normal.
Right.
What is this based on?
And you know what, you're saying this, and I'm like, so much. I would do conferences or keynotes, or I just remember telling my ex-husband all the time, like, I can't feel this. I don't feel any of this.
Right.
I'm a long distance runner. It stopped being fun in all this. Like you talking about, like, sort of your pleasure center has been burned out. I'm gonna have to journal about that.
And his diagnosis is fame and not depression.
We're just gonna have to repair it.
Okay, he's gonna ask Rachel about the experience of finding her brother when he committed suicide, and it's quite graphic and intense. So we're gonna skip forward because that's not really relevant to what we're discussing here in terms of like the brain scan and stuff. All right, we got text on the screen here, and it says, Dr. Amen's database of nearly 200,000 brain SPECT images has shown that physical and psychological trauma show distinct, consistent patterns in the brain. Yeah, and this is probably based on cases where the patient told him, and then he's reading that into the SPECT scan.
So we did a study called SPECT, and SPECT looks at blood flow and activity. It looks at how your brain works. And we just went over 187,000 scans on people from 150 countries. So I know what I'm looking at.
Yeah.
When we look at your brain, there are big holes here. It's like, what does that mean?
Holy crap.
It means your frontal lobes got hurt and they're really sleepy. And I want you to think of the front part of your brain as the brain's brake. It stops you from saying stuff you shouldn't say, from doing things you shouldn't do, from feeling intense emotion. It sort of settles down your emotional brain. And why it really doesn't look like ADD, it looks like trauma, is because your temporal lobes here, they're sleepy as well.
Okay.
And if it was just ADD, you'd see a little low activity here and everything else would be fine.
Here's one of the big issues with these brain scans, okay? He never makes his diagnosis from the images alone. It's always from the image and the clinical history, which is not a problem, except that it's unclear to me how the image would lead to a different diagnosis and treatment from the clinical history by itself. One of the important concepts in medical research and science in general is that your explanation should have predictive power. It's very easy to write down what the patient complains of, do a brain scan, and then explain how the brain scan totally shows what the patient complains of. It's much more difficult to look at the brain scan without any other information, make a prediction, and then see if your prediction matches the patient's complaint. Does this matter? Yeah, it does, because in the second scenario, if the result of the scan matches the result of the complaint, then you have something that can tell you real information. But in the first scenario, you're going in knowing what the answer you're looking for is. You already know what you're supposed to get. Dr. Amen's however many 100,000 scans sound very impressive, But this is the way all of those cases were conducted. He has the patient's entire history and chief complaints, and then he does the brain scan and explains how the brain scan totally shows that too. That's bullshit. SPECT is a useful tool in medical research, but the research is just not there for any uses other than in very specific cases of Alzheimer's disease. Yeah, it's true that depressed people show decreased frontal lobe activity on average, but the variability is massive. Many depressed patients have average activity or higher, and many patients that are not depressed have lower activity. Meaning the test is not diagnostically useful because you still need the clinical history to know whether the diagnosis is appropriate or not. And if you have the clinical history, what is the test telling you that the clinical history is not? You're starting with the conclusion from what the patient is telling you, and then you are reading that into the brain scan. It's confirmation bias. It's like when someone says that if you play a song backwards, it says like Satan or whatever, like, and you do hear it, but you know perfectly well that you would not have heard it if they didn't beforehand tell you that it said Satan. I mean, what's he gonna do? Is he gonna come in and go, actually, no, Rachel, this scan says that you are actually extremely happy and your emotions are extremely well controlled. So fuck what you thought. No, he's going to find somewhere in the brain scan stuff that confirms what Rachel already told him. So why are we doing this scan in the first place?
You hurt this. And you're going to be more emotional than you want to be, more distracted than you want to be. And because you're a high achiever, it's going to frustrate you.
Yes.
And that's going to give you stress.
Yeah.
And so our goal, and I'll show you in a second, is to fix that.
Right.
And we can if you do what I ask you to do.
Okay.
And that's a big thing. And everybody around here knows that the people who really fall in love with their brain and trust me and do what I ask them to do.
I would love to see any evidence of seeing the SPECT scan, making a prediction, and then finding out the answer, because that would tell us clinically relevant information about the applicability of this test. But we don't have that. It is not medically useful to have something that you, knowing the answer already, can go, oh, this shows that answer too.
Their brain gets better.
Right.
Here, this is sleepier than I want it to be. This big red area is here, so you're probably a visual person. But your cerebellum is sleepy. I want you to keep exercising, but I want you to do a coordination exercise if you can. Dance, tennis, table tennis, really helpful for the brain.
Okay.
And your emotional brain is lit up. And it was taught to light up because you never knew when it was going to go wrong. So you never knew when craziness was about to break out.
Okay, I love how he used the term craziness right there. Furthermore, can I just say how ridiculous the conclusions he is drawing from this image are? He knows, based on that image, that Rachel Hollis needs to play table tennis because she stopped exercising. Based on that image, are you fucking kidding me? She just told you she was not exercising as much. You don't need a brain scan for that, doctor. We know that physical activity improves cognitive function and overall mental health. And she just fucking told you that she wasn't exercising like she used to. What the fuck are you referencing a fucking brain scan for? To know that table tennis is the activity that she needs? Is that it? Because You're recommending that for balance and coordination, and the brain scan didn't fucking tell you that either. So none of your recommendations have anything to do with the brain scan that, I might remind you, cost $3,500 and involved radioactive tracers and radiation exposure to the brain. For what? Ugh. I also love how this man knows that her brain was injured, so he knows that the most complex known natural object in the known universe could not possibly have looked that way when she was born. No, it had to be injured to be that way because parts of her brain are sleepy. What are you talking about? What are you talking about? Absolutely alarming.
And so what that did is it took your emotional brain and now you're always watching.
Right.
And that was trained in you. Treatments like EMDR calm it down. And so if I can strengthen your frontal lobes and calm your emotional brain, you're going to be so much happier.
Oh my God. EMDR, or eye movement desensitization and reprocessing, is a treatment that has good evidence behind it for the treatment of PTSD. Most studies suggest that it is at least equally effective compared to cognitive behavioral therapy. I feel like I'm going to become a broken record on this though, but we already knew that she had PTSD. She fucking told you. She told you. She already had that diagnosis. We already knew that EMDR helps with PTSD. Once again, what was the fucking point of this brain scan? It has not in any way altered the diagnosis or treatment recommendations from what they would have been without the brain scan, just based on, I don't know, talking to the patient and looking at their chart. Jesus Christ. Oh my God.
And the pleasure centers, which are right here, are a little sleepy.
Yeah.
So I want to activate those by teaching you how to drip dopamine consistently and not dump it. And that's why I don't want you drinking, because drinking dumps it. Like takes the dopamine you have and which makes you feel good.
Yeah.
But it's a fix that'll fail.
Yeah.
And the more we can get rid of those and then put fixes that help you feel better now and later.
Yeah.
As opposed to now, but not later.
Yeah.
Does that make sense?
Totally. I am tripping out.
Is it possible to not drink?
Yeah. Yeah, actually, this last week I didn't drink because I had just come back from Hawaii where I had a lot of vodka. And I was like, all right, calm down. So yeah, it is. Forever, or like if I'm in a special occasion. I was having breakfast with my boyfriend this morning because he did this too. He was like, you know he's gonna tell you not to drink, right? And I was like, oh, he's gonna tell you not to drink, he's gonna tell you to stop having so much coffee. I was like, you're right. Because he's extremely healthy and I'm close. So never.
The bargaining here is a massive red flag. I have a feeling that I'm going to be in agreement with Dr. Amen on this one because he's now actually using real evidence rather than relying on what is commonly considered to be the most dangerous words in medicine, which are, in my experience. The fact that she actually admitted to, quote, a lot of vodka is troubling. Being so afraid of not drinking forever is a very strong sign that you have a problem. This extreme unwillingness to let go is exactly the problem. You say special occasions, but we all know that will lead to a suspiciously high number of events suddenly becoming special occasions. You know, it's a birthday party, it's a 3-day weekend, it's Friday, it's 9 a.m. on a Tuesday morning. But this week has been like really hard for me so far, Nick. And as your roommate, I don't interrogate you about your drinking. So please, like, don't get into this with me right now, okay? I'm late for organic chemistry. Hey, we're supposed to be talking about Rachel Hollis right now.
We're not even like
Well,
one a week.
So I have scanned and treated 300 NFL players. And one of my players signed an $88 million contract. He's going to play.
Yeah. Yeah.
I'm like, if you're going to do this, you got to do everything else right.
Everything else. Okay.
And so you just have to ask yourself, what's the payoff?
Right.
And what's the risk?
Right. Okay.
I mean, if you have a drink a month, is it a big deal? No, but it's not helping.
Right.
And I want us to rehabilitate your brain.
Mm-hmm.
Part of my goal is to get you to love your brain and then to never hurt it, right? Just like you love one of your children.
Yeah.
You would never hurt them. And alcohol's not its friend. Even though the marketers would have us believe it's a health food and
Right.
it's complete crap.
Right.
He's actually right about that. There's somewhat of a misconception about the statistic that supposedly 1 to 2 drinks is healthy, as in healthier than not drinking at all. This is not true, really. A massive, very important, and extremely well-designed systematic review and meta-analysis of thousands of studies from 195 countries published in September of 2018 blew those previous assumptions right out of the water. It was found that, yes, 1 to 2 standard drinks daily is correlated with lower risk of heart disease in men, and in women, it was correlated with a slightly lower risk of diabetes, ischemic heart disease, and ischemic stroke. However, that is not the same thing as it being healthier. That would only be healthier if those are the only things that you ever plan on being at risk of. Because every other risk associated with alcohol has a risk that increases proportional to the amount drank. For example, cancer risk, including the risk of breast cancer, is higher at 1 drink than at 0 drinks, and it's higher at 2 drinks than it is at 1 drink, etc. Here's the chart. It's showing overall risk increase or decrease, and you can see that for the women, the benefits here in purple and yellow on ischemic heart disease and stroke do not start to outweigh the risks until rather late in life, around 90 years of age. Prior to that, the risk of breast cancer, complications from alcohol use disorder, and cirrhosis outweigh the beneficial effects. On the male side, it is a much, much, much more dramatic effect on increased risk, mostly stemming from the fact that men are the actual worst, including increased risk of murder, drunk driving, alcohol use disorder, suicide, accident, and cirrhosis. Either way, you have to make it through a lot of potential pitfalls in life before you get to an age where that protective effect is going to be likely to be realized. You know, it's not because it gets more protective over time, but rather because if you were at serious risk of the other things, those become more and more likely to have already happened to you and already taken your life. So by the time you get out to like 90 years of age, those things probably are just not the thing that's gonna finally get you. Morbid, right? Anyway, the point is Rachel needs to stop drinking, and the brain scan has literally nothing to do with that. Isn't it amazing what he can do as a doctor when he's using real evidence? He didn't even point to anything specific on the brain. EMDR is already known to be a well-supported effective treatment method for PTSD. So once again, the brain scan did not in any way provide any information that was not already in her chart or provided by her statements. Isn't it amazing, what you can learn It's almost like psychiatrists do a lot more talking with the patient than other doctors do for a reason. Okay, what he's doing here is essentially the same as palm reading, okay? He's listening to what the patient is telling him and then saying, oh yeah, the brain scan totally confirms that. He has had over 15 years to publish even a single paper in which, instead of starting with the patient profile and history and then looking at the brain scan, that instead presents it as the brain scan is looked at blind and then without any other information, and then you make a diagnosis or a prediction, and then you look at the patient profile and history to see how frequently your prediction is correct. And I have to suspect he has not done that despite doing hundreds of thousands of these and publishing many papers. I suspect he has not done one like that because he knows that it won't work. If he thought he could do it, he would shut down the haters like me by performing a simple prospective study and demonstrating predictive power, just like every other diagnostic tool and treatment is required to do before it will be approved. Once again, this brain scan required injection of a radioactive tracer and the use of radiation. That is not something that should just be performed willy-nilly for no reason.
So our goal is to make this better.
I was like joking about there being holes in my brain. I was totally kidding.
So if I look down from the top, it's sort of okay.
Yeah.
If I look up from the bottom, it's not okay.
Mm.
You don't want this.
Yeah.
You don't want to go into your mid 40s or 50s, because what happens is over time it gets worse. If your emotional brain is
Right.
overactive and your frontal lobes are sleepy,
Yes.
your frontal lobes, knowing it,
Yeah.
can't break
Yes.
the emotion.
Right. Yeah.
But it's tapping into the little girl who could have brother to stop hurting himself.
Right.
Right?
Yeah.
I mean, it's the bridge back. And that's where EMDR is so cool, because it'll, you just start with, okay, what happened?
Mm-hmm.
What are you thinking and feeling now? Take an incident with the kids or with your community or whatever, your boyfriend. And then they'll get your eyes going back and forth. It's called eye movement desensitization and reprocessing. And it'll sort of take you back to when it started.
Mm.
And then it'll calm it down.
Mm.
It's really cool
Okay.
and very interesting. It's fascinating.
Cool.
So I think that'll help a lot. And then I want to put you on Happy Saffron Help. It's so good. I love it. It's been shown to be helpful for focus.
Of course. Of course he's shilling one of his fucking infomercial products. There is evidence that saffron extract can help with mild to moderate depression, so whatever, great. But I'd like to see him actually prescribe something that has a little more evidence than a couple studies, but whatever. I mean, it's promising, but it's still very scant compared to the rigors and literal truckloads of evidence that pharmaceuticals are required to provide. I know. Big pharma, right? They just want to make money off of you, unlike Dr. Amen here, who wants to do a $3,500 brain scan. And he has a product that he wants you to take that costs $50 a month that normally sells on his company's late night infomercials, okay? Oh, and did you know that he's also written several books? Maybe you need a copy of one of them, right? It's so nice having a doctor without financial conflicts of interest, you guys.
For memory, for mood.
Great.
And then focus and energy. That's a way to, especially when your team is going, I need you to look at this.
Right.
Take 2 or 3 of those. It's sort of my version of Adderall, but it has no side effects.
Okay.
But don't take it late in the day.
Okay.
No side effects. You know how I feel about that. The focus and energy is just a bunch of green tea extract and ashwagandha. Whatever. The green tea extract isn't going to do shit, but the ashwagandha might be beneficial. Let me tell you, Adderall is amazing, and the Mack Attack channel would not exist without it. So I find that comment offensive. Okay. Let's go.
And then if you're feeling anxious, something like GABA calming or theanine could be useful. You don't have to take the multivitamin. I'm going to give you all the aminos you need in the protein shake.
Okay.
Awesome.
Aha! Jesus Christ, do you see how many fucking products he fucking sold her? It's gonna come to like $4,000. Our girl better come up with a replacement for that Rise conference or she's gonna be broke AF. Although now I'm wondering if she had to pay for this at all or if this is some type of sponsored thing. I guess as long as it isn't on her social media, she doesn't really have to disclose that. And it's only on the YouTube channel for the Amen Clinic, but whatever. It just seems really shady to me. Well, I'm glad Rachel's getting treatment, you know, for those troubles when her team's telling her to look at something. I caught that quote in there. She looked really puffy. I hope she stops drinking. I do. I really do. Here's my problem, okay? That brain scan is not risk-free, and nothing that he said was actually learned from the brain scan. He already knew everything he said about the brain scan from the chart and from the interview, and I don't see how the treatment plan would have been different had the brain scan not been done. He would have recommended the exact same treatments. So why are we doing a costly brain scan with risks associated with the radioactive tracers and radiation being delivered to the brain when it is not indicated by any medical guidelines, has not, despite 15 years of being available, been shown by any peer-reviewed research to have any diagnostic utility, and seemed to have no effect on the diagnosis nor on the treatment plan. I hate it. I hate it. Just because something is new and technological does not mean that it is better, and does not mean that it is even equally good. And it sure as hell does not mean that every patient should be getting one. There are two aphorisms that are commonly stressed in medical education that are very applicable here, and it seems that Dr. Amen has forgotten them. The first is Sutton's Law, which states that you should first consider the obvious, and that the first diagnostic tests should be the ones that will confirm or rule out the most likely diagnosis. And choosing a test should be based on what is fastest and uses the fewest resources while still being accurate. Simple tests should be done before more complex ones. The second aphorism is, when you hear hoofbeats behind you, expect horses, not zebras. In this case, Dr. Amen should have simply considered the obvious, such as depression, an extremely common psychiatric diagnosis, and performed the fastest, simplest, yet still very accurate diagnostic test, aka a patient interview, which he sort of did, except I didn't see the DSM-5 come out. But over the course of the appointment, the patient described classic symptoms of depression to him. Okay, great, boom, horse. There's your initial diagnosis. And would you look at that? Depression has some options for initial treatment that are low risk, not very costly, and could be effective. So recommend and or prescribe those treatments and do referrals to providers like therapists or CBT practitioners. Schedule a follow-up. We're done here. There is no need to go looking for zebras in the SPECT scanner. Why would we do that? try the simpler first-line treatments before getting into the weeds and trying to work backwards. Dr. Amen is a quack. Save your money and spare yourself the radioactivity and radiation. I've been Mack. Peace out. Bye!